Hello, everyone. I'm so delighted to introduce you to Dr. Kripan, AK. He is our AIMS Merit List Rank 1. Congratulations, Dr. Kripan. It's such a great achievement.
Thank you, ma'am. Thank you so much.
So, Dr. Kripan has done his MBBS from GMC Trivandrum and his MS from MAMC Delhi, and he was pursuing his non-academic SRship in AIMS Delhi. Is that right, Dr. Kripan?
Yes, ma'am.
Okay. So wonderful. So when did you start preparing? And I believe we were just having a chat with Dr. Kripan before we began this interview. And you've been qualifying for the INISS, but you really wanted to be in Delhi, and that's how you are here as rank 1. I, I'm
Yes, ma'am.
I'm so delighted because you're so motivated to achieve what you want, and it's so nice to meet people like you. I'm truly actually very, I would say, very inspired by your patience and your perseverance, honestly.
Thank you, ma'am.
Tell us about your preparation journey, Dr. Kripan. And okay, first of all, you tell me why you want to be a plastic surgeon.
No, no, actually, after my MS, I had two options,
Hmm.
either minimal invasive surgery or plastic surgery.
Right.
So my mentor was, during my PG, my mentor was Dr. Rajdeep Singh sir. So he
Okay.
was a very good laparoscopy surgeon. So I had
Hmm.
more than adequate exposure in lab surgeries. So I know
Hmm.
what minimal invasive surgery is.
Hmm.
But I don't have much idea about plastic surgery. But even though I love the subject, I like the subject so much.
Hmm.
But
Hmm.
exactly I don't know what is happening in the plastic surgery department. So I
Hmm.
find it very fascinating. But uh, so before choosing my specialty, so I want to get exposure in plastic surgery.
Hmm.
So I decided to join as a non-academic in one of the good plastic surgery department. So I think one of the
Hmm.
best that was AIMS Delhi. So
Hmm.
after joining the department, then only I realized how fascinating, how interesting is plastic surgery is. The faculties there, the colleagues, the seniors there, they were very helpful and they
Hmm.
taught me so much. So then only I decided to take plastic surgery. I want to be a plastic surgeon. So that was the moment when I finally decided to be a plastic surgeon. The initial 6 months after joining my SRship in AIMS Delhi, I was just uh, enjoying my life in plastic surgery.
Hmm.
So then only after 6 months only I decided that yes, I want to be a plastic surgeon. That is my cup of tea. That is the
Cup of
moment.
tea. Okay. Yeah, that's so nice. And I feel that our branch is so wide and there's such a lot of variety. Like, we operate
Yes,
from
ma'am.
head to toe, and there's so
Yes.
many subspecialties within this super specialty.
Actually, the
I
thing is,
and
a thing I find is there is no limitation for a plastic surgeon.
yeah,
And
true.
the thing is, it's a problem-solving specialty.
Yes, yes,
Whenever other
absolutely.
departments are at trouble, we are there to help them. So that is the most
Yeah,
interesting part and very
most
innovative, I should say.
yes, 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 yes. And I feel that uh, if your passion lies in a subject, and you should just give it your all to explore what that subject holds for you, whether it is, even if it is minimally invasive. And minimally invasive also has gone at another level now. So obviously, whichever branch one is interested in, I feel that one
Yes,
should
ma'am.
really pursue with the hard work. So tell us a little bit about your preparation, Dr. Kripan, and I would really like your valuable insights in how one should prepare, because there are a lot of people who are listening to you and who are going to be inspired by what you say right now. I have interviewed other toppers as well, and they all say that whatever the other toppers say, they take it as like the Bible, and they will just stick to what the other toppers will say. So I will definitely want some good insights from you for the people who are preparing.
Sure, ma'am. Actually, my preparation was a bit different. I will tell how I did and how I should be, other people should do. So
Hmm.
what I did was initially for to get an idea about the plastic surgery, I joined in Delhi as a non-academic SR. So
Hmm.
I just enjoyed my life in plastic surgery for first 6 months. Then I started preparing for INSS. So
Hmm.
I first appeared in 2023 January Jan section. At
Hmm.
that time, I was preparing myself. I started with Grab and Smith, and
Hmm.
I got an idea of the subject from my department. So
Hmm.
I started with Grab and Smith. So I was pretty much confident with plastic surgery. Then I attempted on January. So my rank was 4, but unfortunately, rank was 5. Unfortunately, AIMS Delhi closed. Last rank was rank 3. So I
Hmm.
missed AIMS Delhi by 2 ranks, 1 mark exactly. So
Hmm.
again, I took a gap of few months and I started preparing for the July session 2023.
Hmm.
Uh, the thing was, July session, the question paper was a bit different, not up to different from the usual pattern.
Hmm.
The general study part was very difficult for me, and
Hmm.
plastic surgery was also more of aesthetic surgery questions there.
Hmm.
So it was a different
Hmm.
pattern from the usual. So even I couldn't
Hmm.
qualify that time for my stage 1. So again, I took a gap and I prepared again. All this time, I was using Grab and Smith as my plastic surgery material.
Hmm.
And again, I prepared for 2024 Jan section. At that time also, I used Grab and Smith and added Michigan manual. So I
Hmm.
added points from Grab and Smith to my Michigan manual and I combined all these to prepare. So at that time also, my rank was 10 and I missed
Hmm.
AIMS Delhi by 1 rank and
Oh.
exactly 0.33 marks.
Oh my
So,
God. Okay.
but I know where I was lagging. I was pretty confident with my plastic surgery part, but the
Hmm.
difficult part is general surgery part.
General
So
surgery. Yeah.
actually, then I took a decision I should concentrate on my general surgery part.
General surgery.
So class surgery department in names Delhi is a busy department and a very good department.
Hmm.
So the duties will
Hmm.
be a bit hectic. So
Hmm.
I was unable to concentrate equally on both general surgery and plastic surgery. So I took
Hmm.
a decision before the last session, July session. I resigned from my department 2 months before the exam. And
Hmm.
3 months before exam, I subscribed to Marrow.
Hmm.
Actually, I subscribed Marrow to for my general surgery part because
Hmm.
Rohan sir, I know how he teaches, and
Right.
I during my PG preparation also he helped me a lot. So that's why I
Hmm.
joined Marrow. But
Hmm.
I will come how ma'am you helped me. I will come to that. So I 2 months before the exam, I resigned from my SRship. And
Hmm.
initially,
Hmm.
I started with my uh, general surgery part.
General surgery.
I
Yeah.
come, I couldn't follow any text. I just watched all the videos of
Hmm.
general surgery part by Rohan sir. And
Hmm.
after every topic, I just went into the question bag.
Hmm.
Uh, During that time, I was a bit depressed because I was unable to cover my plastic surgery part also. So then I
Hmm.
started watching your videos.
Okay.
So then I find it very interesting, and that was so helpful for me because whenever I feel boring with my gen surgery part, then I just used to watch
Well,
your videos. That was so, so interesting and that was so relaxing. Like
hmm.
it was very interesting.
It was almost like a revision for you, right? Because you had
Yeah,
already prepared so much of plastic surgery. So it was almost like a revision that, okay, somebody is speaking, let
yeah,
me just
ma'am.
revise.
What interesting for me was we will stress on the important topics and some topic you will say this is not us yet. Maybe they can ask not that important. So I classified my topics based on that, whether it is important
Okay.
or should I stress too much on that. So that
So
helped me
much.
a lot.
Yeah.
So
Hmm.
this time during my 2 months of preparation, I did thorough reading for the general surgery part initially.
Hmm.
Side by side, I started watching all your videos. That was
Okay.
my first revision. So
Hmm.
I finished this in 1 month. So my plan was to finish it in 20 days, but I could finish it in only 1 month. So
One.
after that, I again took my Grab and Smith. So I started reading Grab and Smith. I have a bad habit to read a book from cover to cover. So I don't recommend
Oh,
for others. So I completed my grab and smith, but that is not needed for a
Hmm.
INSS preparation.
Hmm,
But
hmm, hmm.
for my satisfaction, I used to do that.
Used to do that.
Uh, then I finished my grab and smith. During that time, I did questions from
Hmm,
general surgery part. And
hmm,
then
hmm,
my third revision, I revised my general surgery part with my notes. I made my separate note, even though Marrow
okay.
notes are very good, but
Yeah,
uh, I made my separate notes for general surgery
your own
part.
note.
And
Hmm.
then the third revision I did with my Michigan manual. So because my Michigan
Hmm.
manual, I added all the points, important
Everything
points
you
from the
added. Hmm.
uh, grammar speech, and I
Hmm.
used to go back to grammar speech for the very important topics.
Hmm.
So, and I used to sideways. I used to see the question and answer discussion of your video part and the question bank.
Hmm.
So this was my preparation. But I, for a fresher, I think
Hmm.
it is not easy for them to take a grammar smith or Michigan manual and start studying because the
Reading.
class surgery concept and it's entirely different. So I don't
Yes,
think
true.
I could do that because I was working in a plastic surgery department.
Working. Right, right.
But for a fresher, I will recommend either work in a department or should go for a teacher like you. Because
Okay.
there's
That,
these
that's
are the
so
two
nice of you
options.
to say that.
And
So I
yeah,
think the second option is easier for a lot of people.
second answer is easier and less time consuming. I took
Yeah.
2 years to achieve my this rank. So the other way is very easy and less time consuming. So I
I
recommend the
think I
other
was
one for,
just yeah, I was just discussing this with another topper I was interviewing shortly before you. That when we are introduced to a subject, and if we make it too complicated in the beginning, your interest kind of goes away. You feel
yeah,
that
ma'am.
it's just too much to take. So I
Yes.
think when I was making my lectures, I think that was the point that was reigning in very heavily on my head, that okay, I need to make it easy, like just break it down for everyone, uh, as to
Yes, ma'am.
if you talk about skin graft, just make it seem like it's cakewalk. So that's how, if we introduce anything to anybody like that, I think the interest automatically it will come. But if I
Yeah,
start speaking in a very complicated manner, then initially only the interest goes away. So I think perhaps that is with what frame of mind I made my lectures, and I'm glad that you found it useful, and
yes, ma'am.
obviously.
Your videos are, you made everything very simple. So the concepts are here, there, and the theory part is complete, and that is a complete solution, I should say. Your
Oh,
classes.
thank you so much. It's so nice of you to say that, Dr. Kripan. So, also tell us what was asked in your stage two stations. How many stations were there, and what did they ask you? Of course, everybody must be already knowing you, but we would still like to know what questions were asked.
Yeah, ma'am. I attended three times the stage two. So
Wow.
the thing is, because I was working in a facility department, they
Hmm.
more of the question based on practical things, how you
Yes,
manage
right,
this case, how the what or surgeries I attended, what are the steps of surgery. But for a fresher,
right.
more of theory questions will be asked. So that will be
Hmm.
depend on the what, where we are, what is our qualification, what we are doing. So
Hmm.
depending on that, they will ask.
Yeah,
For
that's what,
me, more of
so
a
many
practical.
freshers. So many freshers also got through, and I always tell whenever we are conducting we conduct a Zoom session before the stage two preparation, and many of the candidates who qualified, they've attended that as well. So I tell them that even if you are a fresher, don't think that you will not qualify. That big block, it has to be removed, because there's so many freshers who've qualified in the past for the AIMS merit list. And it's not, yeah, it is an advantage to work in a department, definitely, but it does not mean that if you're a fresher, you can't qualify.
Yes, ma'am, for sure. Because the type of question is based on where we are. If we are, whether
Yeah,
we are a
right.
fresher or we are working in a pathology department. So
Yes,
I don't
right.
think freshers have to worry about that.
Yeah, true. Very rightly said. So, what questions were you asked in the stations?
So one station I was asked whether tell about the one of the plastic surgery procedure I was assisted. I did myself. So that was one of the session for me. The other
And
one
what
was
did you
I was
choose? Which procedure?
RSA flap, reverse lateral flap. That was the
Reverse
last
femoral
surgery I
flap.
assisted. So I
Okay.
went for that.
Okay.
And other session was regarding a dorsum of hand defect and how will you manage. Uh,
Hmm.
that was a practical question. And then
Hmm.
about a burn management of a burn patient. Burns,
Hmm.
cleft palate, syndactyly, all these are
Hmm.
as for everybody.
Hmm. Hmm. Hmm.
It's a very important topic.
Very
So
important.
there is
Yeah,
no
true.
escape from all these.
No escape. Yeah. And even I think maxillofacial
I
trauma
think,
also a lot of times they ask.
yes,
So,
I got a question from angle classification this time.
okay.
During my stage two, I got a question regarding angle classification also.
Angle classification.
So
Okay.
maxillofacial part also important for stage two.
Yeah. And so you had six stations.
Yes, ma'am. This time we had six stations. It's different every time. This time we had six stations.
Yeah. This time you had six stations. Okay. Okay, great. So you feel relieved now?
I am, ma'am. I am relieved, very much relieved,
Yeah, I'm
because
sure. And
it's my
you already,
this is
it's
my
your
dream
dream.
college.
Yeah,
So I'm
I'm
so
sure
happy,
yeah,
and I'm
that
very
relief,
thankful.
that relief is showing on your face.
Yes, ma'am. And I should thank my parents, my siblings, my friends, my teachers, and my family, and my constant inspiration, my wife and my son. All these
Yeah.
people made this happen.
Yeah, I'm sure. And it takes so much to remain motivated for a long time in the preparation. But it's also
Yes, ma'am.
important that you kept working, and I think that was
Yes,
the biggest support that you had. Like, you were not just
Y-
sitting and preparing, but working simultaneously. So
yes,
I
ma'am.
think that must have really kept you going.
Yeah.
So great, wonderful, and the real stage two starts now for you. So
Yes, ma'am.
stage one is done. So it's so great, nice talking to you, Dr. Kripan. So I would just before I end this interview, I would want to ask you about five important points that you will tell to the future aspirants. So let's say for somebody who's decided that yes, they want to pursue plastic surgery, what should be the five most important things on their mind?
As I told, don't take a plastic surgery book and start reading. So it's very difficult, because many of the principal classes we won't feel is realistic.
Hmm.
Many times I felt that this is not going to happen. We'll get that kind
Hmm.
of a feeling. So never
Hmm.
go do that.
Hmm.
Either work in a plastic department, or as I told, get a good teacher like you
Hmm.
for a month,
Hmm.
so that you
Thank
will
you.
understand the principles, and you will get say by the same time you will get theory also covered. So this
Right.
is a two way. You can choose
Hmm.
either.
Hmm.
And then the other thing I want to say, before choosing, be careful. So never because plastic surgery is not what we hear from our PG times. We have very less exposure to plastic surgery. The core plastic surgery is entirely different.
Hmm.
So
Hmm.
you should opt very carefully,
Hmm.
because it's a
Hmm.
very good subject, but this is not what you learn or hear during your PG time. It's entirely
PG
different.
times. Yeah, true. Absolutely true. I will agree to that. And how many revisions?
So for me, my preparation was a 2 year, 1.5 year long
Hmm.
preparation. So every time I don't recommend this. I before every exam I finish, Japan is cover to cover. So I
Hmm.
don't recommend that to anyone. It's not
Hmm.
needed. And
Hmm.
I used to revise important topics at least 2 times before every exam. So
Hmm.
three times I did plastic surgery revision.
Hmm.
And this time I did three revision for general surgery also.
Hmm. Okay. Yeah. So general surgery is equally important. That is something that,
General surgery is equally so that was where I was lacking for last three
very.
time. So this time I could
Hmm.
get rank one only because I prepared general surgery very well.
Equally prepared. Yeah. 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 That's so right. That's great. So wonderful, Dr. Kripan. Thank you for sharing your valuable insights. I'm sure that people are going to watch your interview, on rewind, and they're going to take all the important cues from you. Many congratulations, and you enjoy your time and relax before you finally join your MCH in Ames Delhi. We wish you all the best and big, big congratulations from the Marrow team to you.
Thank you, ma'am. Thank you so much.
Thank you. Thank you for talking to us, Dr. Kripan.